Hi, this is Reality Therapy. I am B.L. Cooper, and this is my presentation. I'll briefly introduce reality therapy to you. William Glacier is an American psychiatrist who worked with Beck on cause and effect therapy, reality therapy, control theory, and choice theory. Our first question that presents is, what techniques do you think are most important in building relationship with Markus while helping him understand the basic tenets of reality therapy? As you can see on the screen, I have language, attending and reflective listening, judgment suspension, establish boundaries, and do the unexpected by using humor. In building a relationship with a client, the most important concepts are how a person makes choices. Let's use Markus as an example. He was unaware of where he was going initially when Angela picked him up. Therefore, the first thing I would make sure to do is use language appropriateness, attending, and reflective listening. According to Edward Neukrug, using a system of wants, direction, evaluation, and plan is essential to building a strong therapeutic relationship. As Markus was already anxious and frustrated with his partner's absence, taking the focus off the present dilemma that he was going through will need my attending and reflective listening skills, while also maintaining good eye contact and genuine concern, sense of interest through facial features. I would also apply structure to the relationship by establishing boundaries. You never know when something may happen, and you have to be protected legally, both the client and yourself as the counselor. I would briefly explain the basic tenets of reality therapy and provide a written copy. I would also ensure that survival, love and belonging, power, freedom, and fun are all included in the brochures that I would be giving him. The second question that was presented is, if you're going to continue to be Markus's reality therapist, how would you use the WDEP system to support him in exploring and creating a plan to strengthen his relationships? First, I would encourage the internal behaviors in healthy relationship by giving Markus literature on caring habits and deadly habits. He will be able to become familiar with internal control and responsibility over his behaviors. For example, initially, Markus demonstrated frustration and anxiety about finishing his doctorate at school. His lack of motivation influenced his hygiene and cleaning his own home. Which presented him to be dependent upon Rob and display signs of depression. Excuse me. Secondly, I would help Markus identify his wants and needs and any obstacles that may be getting in his way. By giving him the caring habits that include supporting, encouraging, listening, accepting, and trusting, respecting, and negotiating differences, it will allow him to communicate more effectively with his relationships and his family and his significant other, Rob. He will also be able to identify the deadly habits, such as criticizing, blaming, complaining, nagging, threatening, pushing, or bribing. This will enable him to begin modeling his own external control that promotes positive choices, bringing need satisfaction to healthy ways. In addition, I would also help Markus explore his total behavior direction through self-disclosure, just a little bit, not much, with emphasis on giving honest feedback. That's a must right there. That will aid in possibly him opening up from self-disclosure and telling us a little bit more about what's going on deeper inside. Then, exploration of his negative behaviors. We would identify those and begin to reshape his current behaviors by discussing briefly his past problems, what solutions were working, what weren't, and focusing on the present and future. The focus is to strengthen Markus's relationships, and by changing his behaviors, he will be able to start fulfilling his need, want, satisfactions that were unmet during childhood. Upon doing this, a plan would be specifically designed for Markus, grounded on discovering wants, evaluating the effectiveness of the direction to meet his needs from a holistic perspective, and to promote the avoidance of destructive behaviors such as arguing and accusing, blaming and belittling, criticizing and coercing, demeaning, demanding, etc. And that comes to reference from Edward Neukrug. Are there any multicultural issues that a counselor will need to tend to? Being of multicultural descent, Markus's family has quite the journey ahead of them. As a counselor, counseling Markus, behavioral and cognitive therapy can be integrated into counseling by teaching others. Clients are more likely to cooperate with culturally diverse therapists when related to changing specific behaviors and developing problem-solving skills, because it offers a solid foundation. Reality therapists demonstrate the respect for cultural values by helping others explore how to satisfy their current behaviors to themselves and towards others. After the client has made his own or her own assessment, they will then be helped to identify the problems that are presented difficulty for them. Then they will be in a position to formulate realistic plans that are consistent with their cultural values. This type of specificity and direction is provided by an effective plan that is beneficial in working with clients of diverse cultural groups. When we're applying rational emotive therapy with Markus instead of reality therapy, are there any major differences? We've already seen that the WDEP system is directed towards wants, directions, evaluations, and plans. Key concepts in rational emotive behavior therapy and reality therapy. And the major differences. Rational emotive behavior therapy, or otherwise known as REBT, is a comprehensive integrative approach that uses cognitive, emotive, and behavioral methods to try and change a person's thinking, feeling, and behaving. It does not provide a clear explanation for the rationale of any irrational beliefs or why one clings to those beliefs, and it does not apply to persons with limited intelligence. There are potential dangers, such as transference of the therapist's own philosophy or psychological harm done to the client by being over-confrontive or persuasive, whereas reality therapy is based on universal principles, needs to be applied differently in multicultural aspects because they have to be adapted to the psychological and developmental levels presented by those individuals. Therapy is not a controlled research study, but it is nationally recognized as evidence-based. As you can see, I've listed 2 to 3 major differences. And I will close with one final remark. Clearly, Markus has the understanding that his relationships were created from his wants and needs that were unmet, and cultivation of the internal control of language played an essential role in helping Markus discover his unmet needs of the past in order to move forward on his own achievements through making the right choices. I thank you for watching, and please feel free to leave any questions or concerns you may have.